I am married to Gran from the Sport and Spine Clinic of Auburndale and Marshfield, and we provide physical therapy and rehabilitation services for mostly orthopedic conditions, but we also do neurological such as balance and LSVT, which is part of the big program for Parkinson's. So after you have an injury, the best thing to do is called the RICE program, which is rest, ice, compression, and elevation, because you want to get the swelling out of that knee right away or out of that ankle. So the swelling can cause immobility that you can't move through the joint, which will also cause scarring. If that doesn't work and say you're still limping even a week or 2 weeks later, but if you're an athlete, you want to get in a little sooner because your goal is to get back to your sport. So a lot of times those athletes need to be seen the next day, either by a trainer, by an orthopedic surgeon, by Dr. Rudolph, or even to us, if you can get to us, with direct access. So you could come here. You really want to make sure that that injury is recovered fully, because otherwise it's going to create more injuries down the road. So say that you've had a chronic ankle sprain that wasn't dealt with years ago, and all of a sudden you're running and it keeps going, and all of a sudden you're getting pain at night. Anytime you have pain at night, that should be looked at right away. Anytime that, say, you can't run as well because you feel like there's a catch in your knee or there's a catch in your ankle, you need to be seen right away. In my mind, that would be something to bring people in. Getting back to function, say if you can't do the things that you used to do, then you want to be seen by somebody, because the compensations will just keep growing, and then rehab takes longer to help you out.